Thank you very much, Chair Boston. Thank you for holding this hearing. Quite honestly, it's been apparent to me, so I'm both a physician and a veteran, married to a veteran who's also a nurse, and I was a nurse prior to becoming a physician. And it's very apparent to me when I talk to veterans in my community and as a physician providing care that the Mission Act is not being fully implemented by the VA. And that became readily apparent when we had our health sub on residential mental health and substance use disorder, where the VA did not even think that residential mental health and substance use disorder fell into the parameters of the Mission Act. And so therefore, getting a patient in within 30 days was not part of that type of care. So I'm just gonna be blunt here, color me unimpressed. You can take accountability for the fact that you got rid of a kiosk system. To me, it's bureaucrats deciding this would be a great idea, we're gonna do this. But guess what? Just like EHRs, we're not gonna talk to the people that use these systems. So we're not gonna talk to veterans to find out what they want, what makes it easier. You've had multiple complaints, you know about the complaints, veterans complain about it, but we haven't done anything. And so whatever money we thought we were going to save by getting rid of the kiosk, that money is now invested into increasing VA employees to train people how to do stuff instead of, and this is the same for the Office of Rural Healthcare, and believe me, I've done this as a physician, we need people who deliver care, not people who study care. It's great that you're talking about advanced directives. All patients should have advanced directives. But do we have to set up a training program, go out into rural areas to make sure veterans have access to knowledge about advanced directives rather than when they're at the facility, it's done? I don't care to increase the bureaucracy of the VA with people who aren't delivering care. What I want is for people to receive care. And we shouldn't have to do a bill that says if you need residential mental health care and you need substance use disorder treatment, that has to be within 10 days because the VA doesn't see it within their parameters to deliver that care. Or that you go to another VISN that's 200 or 300 miles away from your home. Or that we're gonna call you the day before your appointment to make an appointment, which we get under the 30-day timeline because we don't want people going out to the community. Absolutely, there should be oversight of care wherever that care is delivered. Fully supportive of that. But I am not supportive of people who know what their problems are, know that there's access of care issues because people can't get into the VA, but yet don't want them to receive community care in a timely fashion. So, and I think this is both for Dr. Elnahal and for Mr. Jacobs. Has there been a decrease in veterans filing for travel claims?
To my knowledge, Congresswoman, that is not the case. I think we're seeing more travel claims, but I have to get that back to you for the record.
Yeah, because I know veterans who aren't filing for travel claims because of the difficulty of doing that. Dr. Elnahal, how is the VA ensuring optimal diabetes management for rural at-risk veterans to prevent foot ulcers and amputations?
Yeah, it's a really important program that we have, not only care that we provide in person for wound care and ultimately diabetes management to prevent the need for amputations, but we also have a remote monitoring program and a telehealth program specific to that. Again, supported by the Office of Rural Health. And we've seen some really promising results that I'm happy to send to you and your team. Congresswoman, we want to expand that offering as much as we can.
And I certainly think technology can truly help to give access, especially with cameras, our digital ability to do things that we have not had in medicine. But I'm just going to say, it's one thing to take ownership of problems that you know about. But one of the things that very frustrates our veterans and our constituents is that there's never accountability. You still have your job, despite developing a program, rolling out a program that has been extraordinarily cumbersome for veterans. Our rural healthcare office, it's great to study whether or not veterans can have access to studies, especially if their studies cutting edge on medications to treat disease. What I want to know is, are outcomes improved? Do we have less veterans committing suicide? How are we treating PTSD? What's our cancer cure rates? What's our amputation rates for our diabetes? I have volunteer organizations in my district, which receive no money from the VA, are not VA employees, who actually do a better job of reaching out to veterans. And taking them down from a suicide risk and treating their PTSD only because they're just there to serve veterans. That should be our goal and our mission. Thank you very much. I yield back my time.